Well, good morning to everybody. My name is James Mannarino. I'm the Executive Director of Interfaith Works, and I'm delighted to welcome all of you here on this beautiful morning. We're really grateful for this terrific weather. It's very exciting to be here to kick off the affordable health care enrollment, and even though the federal government is shut down, I've rolled up my sleeves, I'm going to loosen my tie, we are ready to go. And we're funded. So we're very, very excited about this process, and we've assembled the most amazing team that I'll tell you about in a minute, but we are absolutely ready and very excited. We're ready to help the uninsured find health care they need to support a better quality of life. It's a very important goal that fits into the goals of Interfaith Works. In partnership with Montgomery County and the state of Maryland, Interfaith Works will focus on enrollment of homeless people, poor people, and vulnerable and hard-to-reach individuals and families. As I said earlier, to do that, we've assembled a trained, multilingual, and diverse team of experts who have all gone through the training and certification to reach out and help those in need learn what options are available to them through the Affordable Health Care Program, and then help them enroll as well. We're very proud of this team, and I'd like to tell you about the languages and point them out to you. They speak the following languages: Spanish, Espanol, right? French, Mandarin, that's where I stop, I don't know how to say these. Mandarin, Cantonese, Swahili, Amharic, Creole, and Mende. That's a really wonderful way to reach out to people in this community who live here, who speak those languages. So will those people please wave your hands and identify yourself? I'd also like to take a minute to welcome our esteemed guests. And I may miss some of you, so afterwards, if I miss you, please wave and tell me who you are so we can acknowledge you. First of all, we have our county executive, Isiah Leggett, with us here today. Secondly, we have our mayor of Rockville, Mayor Marcuccio. The mayor of Gaithersburg, Mayor Sidney Katz. Montgomery County's Director of Health and Human Services, Ahluwalia. Did I say it right, Uma? I apologize. I'm obviously not good with languages. I apologize. Then from Community Ministries of Rockville, we have Agnes Science. I don't know your name. We have Representative from Brian Frosch's office, Senator from Brian Frosch, Wendy Frosch. Thank you. And Reverend Leon Grant, and your congregation is again? Mount Calvary. I apologize for not getting to you earlier. So we are ready. I'm obviously not. I apologize. I also have in the audience Danielle Perry from Congressman Van Hollen's office. There's Danielle back there waving. You can come up if you want. And our dear friend to Montgomery County, Chuck Short. Done about everything there is to do in the county and continues to work hard there. So thank you for being here, Chuck. Anyway, moving on. Did I miss anyone? Oh, I'm so sorry. Come on up and say your name. I'll just let you do it. We met earlier.
I'm Pastor Ken Hawes from Hughes United Methodist Church.
Thank you. Okay, so moving on. This work is a welcome extension of the work of Interfaith Works, and I'd like to tell you why. Our role has been a historic role for 40 years in working in the community as the compassionate voice of the poor and vulnerable in Montgomery County. During those 40 years, we've helped thousands upon thousands of hardworking low and middle-income county residents survive in very difficult economic times and with very difficult economic challenges. We reach out to help the homeless people and those living on the edge of homelessness in the county to move from crisis to stability. For people facing homelessness and poverty, there are so many burdens and challenges that they face every day and that they must overcome, often without a lot of support. That's why lifting the burden of worry about health care and coverage and alleviating the need of making a tragic choice that no one should have to make to forego health care is really something wonderful, and it fits into our mission, and we're delighted to be able to finally do that for the many individuals and families who are currently without health care in Montgomery County. Furthermore, one of our key goals at Interfaith Works is homelessness prevention. Access to affordable health care is a crucial component in that effort, and we know from experience, and we've seen time and time again, how the debt of health care can often drive individuals and families into homelessness. So we are delighted to connect those in need with affordable health care solutions that fit squarely within our fundamental mission of helping them and their ability to finally get the health care that they need. Montgomery County is charged with enrolling over 52,000 uninsured individuals in the Maryland Capital Region, and Interfaith Works is charged with reaching 5,000 individuals, and we will focus specifically on homeless people and people who are with low income. Please reach out to the people you know who are in those categories, because we need your help finding them and send them our way. Our team is equipped to be strong and a steady presence in the community throughout the enrollment period at many locations around Montgomery County. We have a handout on the table just back there that will tell you where we are and how to reach them. And as I said earlier, we're ready. Our sleeves are rolled up. We're going to go. Well, I want to turn over the stage now to our esteemed leaders, and I'd like to start first and foremost with County Executive Isiah Leggett. Thank you for being here and welcome.
Thank you, and good morning. There's a very cynical commercial that's playing in some markets today, which is actually trying to discourage people from signing up. And you need to ask yourself, well, what is the alternative? The alternative is that people show up at the very last minute at the emergency centers and hospitals. The alternative is that you go without health care and you have very tragic results. We are in, unfortunately, that type of debate today. And so although we are gathered here today to get the message out, we have to compete with those who are trying to discourage us from doing what is right. The Affordable Health Care Act is the law. It has been signed by Congress. It's signed by the President and approved by Congress. It has been affirmed by the Supreme Court of the United States. We need to move on and do what is right for the many people in this capital region who do not have affordable health care. In starting today, we will intensify that effort to make sure that everyone that we can contact understand what is at stake, understand that they have a choice, and there's something that they can do about it. Our role is twofold. One, to properly educate and to inform people. And secondly, to make sure that they exercise the option that they would want in order to ensure that they have affordable health care. We have a team of people who are dedicated to this. I want to thank Interfaith Work and all of the partners, our own Department of Health and Human Services under UMA's watch, the various mayors that we have here, all of those who are out there today that need help. We have the partnership to help in this region, from the governor right on down. And one of the things you need to keep in mind is that Maryland is seen as a model. Our governor and lieutenant governor have gone around this entire nation saying that we will, in fact, deliver in Maryland. And I think that we have that opportunity. So let's get out, get the word out, sign people up, make sure that they're informed, and despite the naysayers, we are going to move forward and do what the act requires us to do, is to sign people up, as many as possible, as soon as possible, so that we can make certain that people in this country, in this region, have affordable health care. Okay, let's move forward.
The Honorable County Executive Ike Leggett. Thank you, sir. I'd now like to welcome to the stage the Mayor of Rockville, two-term Mayor Marcuccio.
Thank you so much. You know, I'm honored that Rockville is the place that you have chosen to make your commitment and announcement available to the public. And Rockville has been let's say, a very important city in the county of Montgomery, and Montgomery is an economic engine for the state of Maryland. There's no doubt about it, even with all that prosperity, that we have a tremendous number of individuals who are living on the edge. And it's only groups like Interfaith that make it possible for them to survive in this incredibly expensive economic base. You know, Rockville, as I say, has stepped out ahead in many ways. I'm sure that Agnes is going to tell you about the success of the Casement Clinic. We are so excited that we have a way, at least we had a way before all of this, to address the needs of the poor and the individuals without any kind of insurance. You know, I had a call from my sister this morning. She works for the Justice Department. She's got to go to work for 4 hours and then take her cell phone home and wait for a call. It's very interesting that our government has reached that point. But with an interfaith group like this, you make it happen regardless of what the federal government is doing. And Rockville pledges to help you in any way we can. Thank you.
And now I'd like to introduce a good old friend of mine, and I don't know how many terms mayor of the city of Gaithersburg, but Mayor Sidney Katz. Thank you for being here.
Thank you, James, and we thank everyone for being here. And Phyllis, Gaithersburg stands ready to help Rockville whenever we can. You know that. But you know, we're here today to remind everyone that this is not just about a health care legislation. No one is going to Congress to say, can you please fix something rather than go into an emergency room. We're talking about saving lives. That's what we're here today. We're talking about saving lives. And that is what this legislation does. Just last night, the Gaithersburg City Council heard from John Sackett, the president of Shady Grove Adventist Hospital that serves their region, Gaithersburg and Rockville's region. And they are certainly in support of this. And he said, and you can go online and listen to exactly what John said yesterday, but he said that this legislation is not perfect. There's going to be things that work and things that don't, but the problem is no one knows right now what the things are. We don't know what's going to work and what's not, but we will work together. We will make certain that our community, and as our communities, we have different names in our communities, but we're one community. We're going to make certain that our one community is as healthy as it possibly can be, and that means we need groups like Interfaith Works and all the other nonprofits to help us make certain that our public is as safe as they can be. Thank you for inviting me.
Thank you, Mayor Katz. I'd now like to ask to come to the podium Ahluwalia. I'm really trying, Uma. Thank you. She's the director of Montgomery County Health and Human Services. Thank you for being here.
Good morning, everyone. So we've been working really, really hard. I see lots and lots of folks around in the audience who have worked really hard with us, and I just want to do a real shout out and say thank you. I wouldn't be standing here today telling you we're open for business, right? So you see I'm wearing red because it's red letter day today, not D-Day. We're really going gangbusters. I called a couple of the clinics. They've started enrolling. People have started coming. People are coming to our regional service centers. So I do want to give you all a website. This is really important. It is www.capitalhealthconnection.org. If you go on this website and click on events, you will know all the locations where in-person assisters and navigators are available to help people sign up. I do want to caution, the system is new. It's just going live today, so there are bound to be glitches. Like Mayor Katz said, nothing is perfect, but there's an enormous commitment to make it work, and we cannot make it work without all of you. I do want to thank you. I want to thank our 6 partners who are joining with us. Interfaith Works is a huge partner with us. They have been absolutely fantastic in the planning and the going forward. We have assisters just about throughout this county, throughout Prince George's County. We have to hit a target of 53,000 enrollees, and we cannot do it without you. It's a couple of things to remember, right? We've got to push and let people know that healthcare is a right. It's an important quality of life issue. It's important to have healthcare. It's never, never, never acceptable to go without healthcare because you have to pay for food or rent. So we really want to emphasize that. And the second, when you have health care, we must teach people to use it, right? That's important too, because if you haven't had it, you won't know what to do with it. So we have a responsibility, not just with the enrollment, but with beyond. So with that, I say thank you, and let's go forward and do great things. Thank you.
Thank you, Uma. And we really appreciate the support you and your organization, your department have given to us. Thank you. I'd like to welcome next to the podium the Reverend Leon Grant from Mount Calvary Baptist Church. Please come to the podium.
Good morning, everyone. I'm delighted to be here today as a partner in this affordable health care outreach. Mount Calvary is located here in this community, and we have always worked with the community in trying to better the community. And this is a wonderful way for everyone to get involved. Now we can reach out to those who could not afford health care previously, but now they can reach the health care because it is affordable for everyone. And we are right across the street. We are a site where you can come. There is plenty of free parking. All you need to do is come over, and there will be people there to help you get involved and get signed up for the affordable health care. Thank you so much, and may God bless each and every one of you.
Thank you, Reverend Grant. I'd now like to welcome to the podium Reverend Ken Hawes from Hughes United Methodist Church in Wheaton.
Thank you and good morning. It is a privilege to be here this morning on this historic day for our nation. Adequate health care is a basic human need, and being certain that basic human needs are met is an issue of justice, and it's an issue and a measure of the quality of our society. But as of today, many of the uninsured will now have access to affordable health care options. We had a conversation at Hughes Church in Wheaton with our Spanish-speaking members on Sunday, and we're talking with them about the Health Care Act and how important it was, and talking about some of the fallacies that have been lifted up and some of the good things, the many good things about the Health Care Act. And we realized that many of those members do not have health insurance right now. These exchanges will have a direct impact on the lives of people in the Wheaton area, in the lives of people throughout Montgomery County, and the lives of people around the United States. We all know people whose lives will be changed forever by the Affordable Health Care Act. As a pastor, I've always believed that faith communities are the strongest when they reflect and meet the needs of the neighborhoods in which they are located. And now villages and towns and cities are at their strongest when the government and nonprofit social service organizations and faith communities and citizens partner together to meet the basic needs of the people who live there. And that, in that way, we build a community where justice and liberty are truly available for all people. So Hughes United Methodist Church is proud to join in this partnership to care for the citizens of Wheaton and strengthen the community in which we live and serve. Thank you, and God bless you all.
Thank you, Reverend Hawes. We appreciate you being here with us today. Now I'd like to welcome to the stage from Congressman Van Hollen's office to say a few words to us, Danielle Perry.
Good morning. Congressman Van Hollen is so excited that today the Maryland Health Connection and Health Exchange marketplaces nationwide open their doors and begin to transform the way that people can shop for quality, affordable, individual health care coverage. For the first time, American families shopping for coverage directly for health insurers are going to be able to compare health plans side by side, see if they qualify for a cost break, and sign up for coverage that meets their care needs. As you can see, obviously, from last night, Congressman Van Hollen has been on almost every television network singing the praises of the Affordable Care Act and fighting for every American to get equal quality health care. And so today, I just want to express from Congressman Van Hollen that we're excited that Maryland is taking the forefront and the lead on this, and we're happy to work together with all of you to make this happen. Thank you.
Please send our thanks to Congressman Van Hollen. I'd like to now welcome from Senator Frosch's office, Wendy Frosch, to say a few words on his behalf.
Good morning. It is a privilege to be here on this glorious day to celebrate this remarkable, exciting, groundbreaking Affordable Care Act launch. Maryland has played a leadership role in making the Affordable Care Act a reality in this state, and in Montgomery County, I think we're very lucky to have the opportunity that an organization like Interfaith Works brings to us. Affordable care for everybody, I believe, is a right. It is a privilege to have access to the most wonderful health care, and ensuring that all of our citizens are able to access care is something that we are committed to and committed to seeing through. So thank you for being here and joining in this partnership.
Please send our thanks to Senator Frosch. We're almost there. A couple of more speakers. I'd like to welcome now, representing Bishop Darlingston Johnson from Bethel World Outreach Church, Nina Lawson.
I want to thank you all for being here today. Bishop cannot make it, but I want to thank you for helping us and also to allow us to be a part of this great healthcare program. Our church is located in Silver Spring and in Montgomery Village. We have over 45 nations represented, and most of our activities is also, we also help the community, and we do a lot of community outreach. And we see many people, and especially a lot of our members and the community people that we help don't have a health care insurance. And we think this is a great opportunity for us to be a part of this health care program, that we can be able to help people more and also be access where people can come and register for the health care. Thank you.
Thank you, Nina, and please send our thanks to Bishop. Okay, I have one more speaker, but before I bring her up, I'd like to just say that this is an Interfaith Works event, yes, but we share this stage with many, many people who are involved in this rollout, and as Uma said, 6 partners in the county. And I wonder if any of you are here. Any of the other, we have lots of partners here. Well, I think in the interest of time, too many to mention your names, but I thank you for being here. Thank you for your efforts. None of us can do this alone, and we're looking forward to working alongside with all of you. So great to have so much great representation here today. Finally, now I'd like to ask to come to the stage Agnes Science from the Community Ministries of Rockville and the Mansfield Caseman Clinic.
Thank you, James, and good morning. The Caseman Health Clinic, a subsidiary of Community Ministries of Rockville, is delighted to partner with Interfaith Works and also the Montgomery County Department of Health and Human Services in this effort to help people with enrollment in the Affordable Care Act. The Caseman Clinic will be one of the sites. We will have someone Monday through Friday, 9 a.m. to 5 p.m. And we welcome the community. If you have questions about if you are eligible or not, if you don't know how to go about enrolling, we are there to answer your questions and to help you. If for any reason you happen not to be eligible, we welcome you to the Caseman Clinic and we will take care of your health care needs. So please come to the clinic and we are there to answer your questions. I invite you all to walk 2 blocks. We are only 2 blocks away to the Caseman Health Clinic. Get your exercise for today, and you can see one of the sites in operation. I'll be happy to follow the crowd, but welcome to the Caseman Clinic and look forward to seeing you all there. Thank you.
Thank you, Agnes. We have maps in the back on the table to follow, Agnes, if you'd like to go over there. That will start about 11, which is in about 30 minutes. And we promised that we would be about 30 minutes, and I think we've made our goal, so that's great. I'd like to thank all of you for being here today. I think this is a really historic day and a wonderful day, and we're very excited to move forward. Thank you to the support of all of our elected officials and the pastors who have come today to support this effort and show how very important it is for Montgomery County. And we look forward to working with you. Please visit our table in the back and have a wonderful day. Thank you.